Welcome to Cancer Newsline, a weekly podcast series from the University of Texas MD Anderson Cancer Center. Cancer Newsline helps you stay current with the news on cancer research, diagnosis, treatment, and prevention, providing the latest information on reducing your family's cancer risk. I'm your host, Lisa Garvin. Today, our subject is supplements and cancer. We have two guests to talk about that topic today. Dr. Richard Lee, who is the medical director of the Integrative Medicine Center here at MD Anderson, and Laura Michaud, who is manager of the Clinical Pharmacy Services here at MD Anderson. Welcome to you both.
Thank you.
I guess supplements can mean any and all things, but how do you guys describe what supplements are? Laura?
I think there's a number of different kinds of products that can be grouped into that category. It includes things like vitamins, vitamin C, vitamin A, all those things you can buy over the counter. But it also includes a lot of other natural products, things like herbs, other natural products like soy, things like CoQ10, glucosamine. I mean, you could go on and on with all the different types of supplements, but basically they're things you buy over the counter that aren't classified as drugs.
It would seem to me that a lot of cancer patients are into the natural, nutrients and everything. Do you get a lot of patients who come in saying, I'm taking this and this is helping my cancer, or they believe that to be true? Dr. Lee?
Yes, supplement use is extremely popular, and there have been several studies showing the prevalence rate sometimes being over 50% looking at different cancer patients. So it's a very hot topic right now in the field.
Have you found that there are claims out there that people are saying that certain supplements like antioxidants give you kind of an anti-cancer benefit?
Mm-hmm. These are very popular claims that we come across that patients bring in either in brochures or they heard on TV, that these type of products can either prevent their cancer, treat their cancer, or somehow enhance the treatments they're undergoing.
What do you do with a cancer patient? I mean, Laura, you deal with, pharmacy and drugs. When patients come in, they are supposed to bring a drug list with them, are they not?
Yes, absolutely. And we highly encourage patients not only to bring the list, but to actually bring the bottles. So with the actual medications in them, both prescription and non-prescription items. And that's really important for supplements because so many of these things have different ingredients. If you just have a brand name, there might be 5 different kinds of that certain brand, and it's really difficult to know what's in it just by the name. And that goes for prescription medications as well. It's really important to know dosages and whether it is a combination product or just a single agent product. So it's really important for us on the medical end to have a really accurate list of what the patient's actually taking.
And I would think that supplements are not regulated by the FDA, so dosages and strengths can differ even amongst the same brand, correct?
Well, there are some regulations. They aren't regulated like drugs, so it's a much less regulation. There are some good manufacturing guidelines that the FDA puts out. There are also some other types of regulations that they regulate, such as the claims that can be made about certain supplements. But the safety and efficacy claims are not proven and don't have to be proven. But for drugs, they actually do have to be proven before someone can market them to the public. So there are some regulations, but they're more like food is regulated in terms of contamination, safety, those kinds of things.
When we get, go ahead, Dr. Lee.
I just wanted to also add, in addition to that, looking at issues of quality regarding these type of products. And so I think patients should understand that even though there are green tea type supplements, that different companies will produce them differently. So you actually may be getting different compounds within them. And recently we had a speaker coming in from the outside who looked at over 20 green tea type products. And what he actually found was that 6 of them didn't even contain any kind of green tea compounds. Another large percentage of them didn't have the amount of green tea that they had on the label. So actually only a minority had what they actually had listed on the label.
When we are dealing with cancer, there have been some studies, I understand, that there are certain compounds that actually might have a negative impact on cancers. Can we talk about that? I think they were beta-carotene, B12 folate, and then certain antioxidants. Let's talk about beta-carotene, for instance.
There have been some very large randomized trials that have looked at beta-carotene. One of the most published studies looked at beta-carotene's ability to try to prevent lung cancer in those at high risk for lung cancer. So either smokers, current smokers, or former smokers, or those considered at high risk. What they actually found over the period of the trial was that those who actually received the beta-carotene supplementation versus those placebo pill, those who got beta-carotene actually had a higher risk of developing lung cancer than those on the placebo arm. And that was been shown in more than one study.
What seems to be the issue with B12 folate? What have studies discovered?
There was a recent study published in JAMA looking at B12 folate supplementation on cancer risk. This was a study in Scandinavia where they provided B12 folate actually for cardiovascular reasons. And then they went back to look at cancer risk, and they found that those who got B12 folate supplementation seemed to have a higher risk of cancer development than those who did not.
And antioxidants, I think that word has been thrown around. I mean, obviously the word means like kind of anti-cancer. Antioxidants or free radicals. But it seems like antioxidants might have cardiotoxicity.
I think it's really important to point out that free radicals and reactive oxygen species, which is really what you're talking about with those things that scavenge those, are not all bad. And the fact that a lot of our chemotherapy agents rely on that as part of their mechanisms to kill cancer cells. So there is a potential to have a negative effect on what you're trying to do with our traditional therapies in terms of treating their cancer. And there also may be additional risks in terms of just what the antioxidants do by themselves in the body in terms of cardiovascular risk. I don't know if you want to speak to that, Dr. Lee.
Yes, just following up on your comments, in the study looking at beta-carotene, they not only found that there's a higher risk of lung cancer formation, but they also found that they had a higher mortality rate. And that seems to be due to increasing incidence of cardiovascular events like heart attacks. In addition, like you mentioned, there was a study where they looked at antioxidants during radiation therapy for head and neck cancer patients. And what they found was it did seem to help reduce side effects. But long term, there seemed to be a higher recurrence rate of their cancers as well as a lower survival rate in those patients who received the antioxidant therapy. The concern there being that the antioxidants may have interfered with the radiation treatment effectiveness.
So how do we deal with cancer patients who want to take supplements? Is there any standard recommendation for cancer patients who obviously have nutrition issues, a lot of them? What do you tell them?
I think the major thing is that you keep an open conversation with the patients. I think that many of these people are just trying to do the best for themselves and to make sure that they live as long as they possibly can, despite their cancer diagnosis. I think one of the biggest resources we have here is our dietary consults through our nutritionist. And trying to get your nutrition through actual food is probably the best thing that a patient can do for themselves. And all those things that you hear about all the time, diet and exercise, are just healthy choices all the way around. And we have wonderful dietitians who can help you in terms of what kinds of things you can do to your diet to make sure you have a balance throughout your entire day. And they have fancy software and stuff that can even help you in terms of tracking what you're eating and how you're eating, those kinds of things, how you prepare your food. I think that's the best thing that patients can do. On the other note is if people really feel the desire to take supplements in addition, I think it's really important that they tell us what they're taking so that we can evaluate it and really talk with them about the risks and potential benefits and try to approach it from a scientific perspective and not harm them in the course of them trying to do everything they can. I don't know if you have anything.
I second your comments there about really trying to have an open conversation, thinking about whole foods, and using the dietary consultation service that we have here for patients to really get an assessment. I think the way I approach supplements is really looking at them like medicines. Anytime you take a whole food product and you process it into a pill, a powder, or a liquid, then it really becomes more like a medicine. A common question I get all the time is talking maybe about vitamin D, which is another hot topic right now. And so patients will say, well, how much vitamin D do I need? And what I'll say is, well, have you had your vitamin D level checked? And then first, let's see what your level is, because if it's normal, you may not need anything. But if you're deficient, then we need to supplement you. And if you have high normal levels, maybe you need to back down on the vitamin D supplement you're on. So really thinking about an assessment, either through blood tests or with a dietitian, to see what your whole food nutrition is like, and then proceeding from there, I think is a good way to start.
We had discussed earlier that, if they wanted to take a vitamin, like a multivitamin, a standard multivitamin would take care of most of their recommended daily allowances. Is that correct?
Absolutely. And I think, too, for example, postmenopausal women, calcium is very important, and vitamin D would be important in terms of making sure you absorb the calcium in those supplements. But I think as Americans, we don't do very well at getting certain things in our diet, and I think that's where the dietitians can really help you make better choices with what you're doing with whole foods. And then if you really need assistance taking a good general multivitamin, I think it is a good thing to do. Being careful that a lot of the vitamins that are out there have mega doses in them, and you really need to be careful about the amounts of things and how they add up. If you're taking multiple supplements that all have vitamin D in it, for example, you have to take into account that you're not only getting all that vitamin D, but you're also getting vitamin D from your diet. So you have to kind of include everything that you're doing.
Well, it seems like there is, in certain populations, a more is better mentality when it comes to supplements. Do you see a lot of that amongst our patients here?
Yes, they read an article and it says, oh, this is important, and it is, but too much of a good thing can actually be dangerous. And I think these studies looking at beta-carotene supplementation, vitamin A, vitamin E, B12 folate are showing that once you get to really high doses, you might run into other harmful side effects related to them.
So in closing, Dr. Lee, what would be your take-home message to people who are considering supplements, not only as a cancer patient, but just for overall health?
I think supplementation can be an important part, especially for those who have diagnosed deficiencies. But really, I think patients as a whole should be really thinking about food and nutrition as their best source of vitamins and minerals, rather than trying to achieve that through pills or powders or liquids.
And Laura, you say there are good online resources where people can check into the efficacy and safety of herbal or natural supplements?
Absolutely. Some of which are free. Obviously, our website has a very good page, or several pages that are available to patients, and they can look up supplements and things. But most importantly is talk to your healthcare providers about what you're thinking about doing, about your rationale, and really keep that conversation open so that everybody's aware of what you're doing and can help you to assess kind of the benefits and potential harms. That's the best advice I would have.
And it sounds like on top of that, a drug journal would be a very good idea.
Yeah, absolutely. Keep a list, or at least bring a bag with you when you come to your visits.
Thank you both. Very interesting topic today. Thank you both for being with us.
Thank you.
You're welcome.
If you have questions about anything you've heard today on Cancer Newsline, contact Ask MD Anderson at 1-877-MDA-6789 or online at www.mdanderson.org/ask. Thank you for listening to this episode of Cancer Newsline. Tune in next week for the next podcast in our series.